All right, good morning, everybody. I'm Waqas Haque, and I'm here with our next episode of our Oncology Data Advisor podcast, joined today by Dr. Aamir Ehsan from CorePath. Thanks so much for joining us, Dr. Ehsan.
Welcome. Nice to meet you, Dr. Hart.
Yeah. So just a brief introduction for Dr. Ehsan. He's a pathologist by training who did his training originally in New Jersey, did further training in transfusion medicine at Ohio State University, then did his heme path training at San Antonio, where CorePath is based. And he has a lot of extensive experience in sort of directing, different pathology labs and being at the forefront of pathology innovations. So Dr. Ehsan, sort of kind of get to the sort of meat of our conversation today. Tell us a little bit about what CorePath does and some of the improvements you've seen in diagnostic accuracy and efficiency through the diagnostics that your company offers.
Yeah, thank you, Dr. Hart. CorePath is a cancer reference diagnostic lab headquartered in San Antonio. I'm a hematopathologist, board certified hematopathologist and molecular geneticist. We have been in operation since 2009, and we have been providing basically oncology related diagnostic services, which, as you know, is pretty comprehensive. So we offer all under one roof that include basic morphologic interpretation, flow cytometry, cytogenetics, fish analysis, and lastly, but most importantly, the next generation sequencing.
Got it. And tell us a little bit more about CorePath's collaboration with the Genomic Testing Cooperative and using the AI for NGS diagnostics.
Yeah, so basically, as you know, the hematopathology and oncology diagnostic side is very complicated and convoluted. You cannot rely only on one tool. Um, Cancer diagnosis is a very comprehensive analysis of all the data. So even though we have other tools like morphology, cytogenetics, fish, molecular, and cytogenetics, there is always a need of having collaboration with people or expertise that have more insight into the genomic side. So GTC was a very national collaborative partner, and Dr. Albertar, who has immense experience on the molecular side. We talk to each other a lot. We collaborate on different cases. Molecular is one important side of making the cancer diagnosis, and based on that, the treatment decision and prognosis is made. But that also need to be collaborated with other testing, right? Morphology and flow and cytogenetics. So it was a national kind of collaboration that we started that as we see more and more tumor and more cancer, mutation is one side, looking at the DNA, but how the tumor is going to behave by looking at the RNA is also very important, right? At the end of the day, we are looking at what does it mean to the patient outcome. So when we look at the data that GTC is producing, looking at the DNA and RNA, and looking at the more holistic approach of a genomic profile, it was very obvious and natural that we need to collaborate and have data sharing and create a comprehensive integrated report that include all aspects of cancer diagnosis.
Yeah, and it's so exciting to see how much is really changing, cancer care, both at the diagnostic and the therapeutic level, right? Just thinking about in liquid malignancies, just looking at the idea of MRD or minimal residual disease, where we can get to such high sensitivities to see if there are any remaining, tumor burden that patients have, and even in treatment settings, even in solid tumors, for example, lung cancer, sometimes you even wait to get the genetics panel back to get the patient on the right, targeted treatment for their mutation profile. But tell us a little bit more about how these partnerships impact, patient care, specifically in regards to turnaround times or helping make, better treatment decisions for patients.
Yeah, definitely. I mean, I can just give you a real case example that happened last Sunday. We got two acute leukemia cases on Sunday, and we were able to give the diagnosis within a few hours based on the flow cytometry. But it was acute myelogenous leukemia, and oncologists were looking for more, more data, more information. So this collaboration resulted in expediting some hotspot genes like FLT3 and IDH1, IDH2, and NPM, because some of those results are needed within few days of making the diagnosis. So this collaboration is helping us not only getting the right data and enough data, but quick turnaround time, which, as we know, is very important for cancer patients. So we have a comprehensive, evaluation of the leukemia in this particular case, and working with GTC bring, fast turnaround time that we have evaluated other turnaround time with other, partners as well. But this turned out to be that not only we are getting the fast results, but we are getting a very comprehensive analysis of both DNA and RNA expression as well.
So you talk a little bit about the fast turnaround times and the really strong profiling that your team's been able to achieve. Why don't all hospitals have this capability? Like, why don't we all have different AI tools in our pathology workflows?
Yeah, it's kind of interesting. The world is changing. The hospitals are adopting the technology, but as you know, that even in United States, there are hospitals in the rural-based setting which are doing the thing very archaic way, old-fashioned way. So it's a challenge. Executives and the hospital leadership is looking at the information and the data. And the key thing is the patient outcome with a quick turnaround time, especially when it comes to the cancer patient, right? So one of the good example that I can reference to is we have a practice in Southern Illinois, closer, of course, to Chicago, which is in Carbondale, Marion area. And we don't have, it's very challenging to find a pathologist over there, right? So we were able to launch the digital pathology so that digitized slides can be uploaded into the cloud environment and can be evaluated by pathologists or hematopathologists in San Antonio. So that's really helped us. And it was a very unique and new experience to the executives over there. But once they adopt the technology, they really love it. The turnaround time improved, the shipping and all those kind of delay has been avoided. So
Yeah.
I feel like it's an evolution as more and more executives in the hospital setting are understanding the concept of the AI and digitization in the cloud-based system. People are embracing technology, and I mean, they look at the ROI. What if I invest in technology? There is no CPT code right now that can be reimbursed. But College of Medical Pathology has certain CPT code that has been in place. Those are not reimbursable yet.
Okay.
But at the end of the day, the FTE saving, the time saving, the turnaround time saving eventually leads to the ROI overall.
Got it. And I kind of want to touch on one thing you mentioned that in some parts of the country we have a shortage of pathologists and people embrace technology to help sort of make up that gap. And people always get scared about technology and robots replacing all the humans and all the employees, but looks like CorePath is actually doing some work to address the supply demand gap in global pathologists. So tell us a little bit about the work in medical education that you are working on.
Yeah, one thing I can say that the AI and the machine learning and robots, you are definitely having two advantages that no one is calling a sick leave, and there is no person, and there is no personal issue, right? So anyway, I think as we know that the need of the healthcare, especially for cancer, is enormous, right? The patients are living above 80 years of age, 90 years of age, and the supply of the healthcare when it comes to pathologists is very limited. The program, residency program directors are not increasing the way we would like to have. And then you expand to the global level that there's an enormous shortage of pathologists, just like other healthcare providers. So the only way the supply demand bridge can be narrowed is through technology. I would rather not drive 40 minutes to work, but have digitization, everything on the cloud.
Mhm.
That's really the solution. And this anxiety of those pathologists that, well, AI or machine learning is going to take my job away.
Mhm.
Typically, the a standard statement is definitely those pathologists who are going to adopt the technology is going to be marketable,
Right.
and those pathologists who are not going to embrace is going to take their job away. So I think we as a healthcare providers definitely need to look into adopting the very interesting technology which is out there waiting for all of us.
Right. Yeah, definitely. And and I was reading a little about the rotations and electives that pathologists or people interested in pathology can do at CorePath. And it sounds really exciting as well for people trying to get more experience and maybe do residency as well if they've done medical school somewhere else.
Yes, yes, definitely. I think one of the programs that I launched at CorePath, we call it HemePath Hub,
Uh-huh.
where we are taking pathologists coming not only from US but from around the globe. In last 3 years, we have taken about 80 or 90 of these interns or pathologists or physicians. And I mean, they have not experienced this technology anywhere in the world, right?
Right.
So they come here, they get excited, they see all this technology under one roof, and it creates, an interesting perspective. They work with us, they publish, they have done abstract publication and all those kind of things. And they some of these physicians who are hematologists have gone back to their country, and we
Mhm.
have trained their. I mean, human capital is the most important thing around the globe, right?
Right.
If you train people, so now the cloud-based setup and the human capital investment, we were able to create in Pakistan, for example, at Indus Hospital, a genetics lab. They were able to establish a wet genetics lab. The data get uploaded on the cloud. We look at it from remotely from here.
Mhm.
Eventually, they are trained enough to bring everything in-house. So that led to the establishment of a genetic fellowship program over there. So these all things happen like within last 2 or 3 years.
Wow.
So the more engagement, the more opportunity that we open the door for trainees to learn. Cancer patient, no matter where the patient is, need to be treated the same way.
Yeah, definitely. No, thanks for sharing all that, and that sounds really amazing. All the progress you've been able to make. Just kind of as we sort of wrap our conversation, just a couple other questions. Can you discuss any kind of ongoing projects or different collaborations that you're working on? I read a little bit about some of the work that CorePath is doing in standardizing the HER2 scores, given some of the recent approvals in this area, especially in breast cancer. But curious to hear a little bit about some stuff you all are working on now.
Yeah, definitely. There are a couple of things that I would like to mention. One is we recently worked on the HER2 new breast cancer. As you know, it sometimes the data can be very subjective. So we work with ASI and Motic digital scanning company.
Hmm.
We digitize a slide. We use the application of AI software on it, and the whole goal was how to objectively look at the data because a decision like HER2 is very critical for patients, and sometimes it can be very subjective. So the
Hmm.
whole purpose was get the slides ready, get the special stains ready, fish ready, digitize it, use the AI tools, and score them and create more objective data, which is actually better for the patient outcome.
Right.
The second thing that we have done recently, just very recently, is we are collaborating with a company called MindHives,
Hmm.
and they have introduced a very innovative software which they call Chiron.
Got it.
Now,
Okay.
Chiron software is really playing a critical role in creating and refining the conscious learning driven machine.
Mhm.
So it kind of act and react with the person had been using it. So
Mhm.
this is going to be this is actually using the multiple AI platform and different deployment models. This is going to be a game changer, definitely using all these kind of tools and advancing the healthcare. And not only on data driven, but also emotionally driven,
Yeah.
how you react and how the kind is going to be producing the data is going to be amazing. So I'm very excited to be collaborating with them. I think the more data is going to be coming out of that. And
Mhm.
at the end of the day, you know that when it comes to cancer, pathology is really the hub of all the centralized data.
No, definitely, and that's really exciting to hear. And kind of as we wrap our conversation, you're doing a lot of work as a pathologist and sort of the business side with CorePath and medical education. So, what's your information diet like? How do you keep up with things? What do you like to read? How do you kind of keep on the look out for new information?
Yeah, of course, we always identify certain key journals and certain key meetings and conferences that we go to. But it's kind of interesting through this company called MindHive. They have a tool, of course, Chiron I talked about, but
Right.
Ava is another tool that if I go to ASCO and I ask Ava that show me the abstract which are only related to acute lymphoblastic leukemia, I
Mhm.
will get a very nice summarized abstract within like 5 minutes, and I can just browse it in like 10 minutes of my time.
Yeah.
So I think these AI tools is definitely that we are using, and it's going to be used by us as physicians because we are getting so much overwhelmed by knowledge. So I think the smart intelligence tool that I just mentioned is what we are using. But
Mhm.
of course, I focus more on key pathology related meetings and certain journals.
Awesome. Well, thanks so much for your time today and answering the questions and all the best with CorePath and all the work you're doing.
Okay, good luck to your future as well. Thank you.
Yeah, thank you.